mentioned earlier in the show this morning, the CDC is warning doctors that this year's flu vaccine may not protect against a common form of the virus. This is a really important discussion we're going to have this morning, so I really hope you'll pay attention. This year's flu vaccine is not working the way it should be, and Dr. Richard Oyler of Compass Urgent Care is here to talk about that. And first of all, we call you Dr. O. I hope that's all right.
Oh, absolutely. That's what everyone calls me.
Well, and I bet a lot of people are calling you right now. What is wrong with this flu virus? I mean, we think it's meant to protect us, and it is, but something's happened.
Right. The flu virus has mutated. The CDC made a good guess on what flu was going to impact the United States this year and had the H3N2 virus in the vaccine, but it mutated. The vaccine's still effective, but not quite as effective.
Because a flu virus is a living thing, and it does change.
Sure.
So, now, you were telling me that has you guys taking extra precautions, because normally you could take the flu shot and you'd be okay. But in your office, you have to do some of the same things we're going to have to do.
That's right. We're very nervous. We're breathing the flu virus all day long. We're very, very nervous, being extra cautious on hand washing, not letting patients cough in our face, and everyone really needs to get the flu shot still. It takes 2 weeks to kick in, but
That's interesting you say that, because if we're telling people it's not as powerful as it should be, you're still telling us to get it. Why?
That's right. The flu vaccine still provides some protection. So instead of having a severe case of flu, it'll be a little bit blunted. The H3N2 is notorious for causing hospitalization. It's worse than that swine flu we had.
Wow. Okay, so this is serious. All right, let's talk about somebody getting the flu in your family or workplace, and you work very closely with them, and you have no way to avoid it. Is there anything we can do beyond just washing our hands and staying healthy?
That's right. There's the antiviral drugs. Tamiflu is the most prescribed one. If you catch it early in the illness, within the first 48 hours, it's most effective. And take it for 5 days, and it will suppress your symptoms faster than not. You can also prescribe it for the family members.
And you tell me you're doing that at your office.
We do. For the family members that are there, we'll write the prescription that's 10 doses, once a day for 10 days, to help decrease the risk of them getting the flu.
Wow, that's huge, folks. So, Dr. O, we're going to be monitoring this. We'll probably be coming out and visiting you as this progresses to see how we can track this out of Compass Urgent Care, if that's okay.
Absolutely.
All right, good advice. I'm going to shake your hands, and then I'm going to sanitize them. Hey, just a good idea.